on the top. So you'll see them in the little circles on the top. And then as you go through, you can see, see that if you go onto the person's name, then you can schedule with them. So pick the person that needs the appointment and click on their name, and then you can go to the visits button and go down to schedule an appointment. And then, I think here probably is not gonna work. No. Okay, there we go. And then again, it goes to the employer clinic visit.
Slower than normal.
It is. Same thing, where you need to verify that this address is your correct address, and then hit continue. And then it's going to ask the same thing for your insurance information, so verify that it's your insurance, that it's correct, and hit continue, regardless if it is or not, because we do check it on our end, and if you try to change it on your end, it may not let you make the appointment. So you're going to go to City of Appleton, and then continue. They have made some good updates to this. Again, you're going to have to pick if you're the spouse, retiree, child. In the past, you had to pick one of our providers, but now it has everything listed for you. So as long as there's a purple line underneath or behind by Jess's name and Heather's name, then you can pick both of them. So it would be the next available appointment instead of going out and not being able to choose both of them. So you can go to continue. Now, Jess is off this week, so you're going to see just appointments for Heather, but if Jess was on this week, you would see both appointments for Heather and Jess, and then you can pick the time that works the best for you. So once you pick the time, you would go to the next appointment, and then again, it's going to ask you why. So as soon as you put in the reason why you would like the appointment, then you can make the appointment and have it set up for you. So you need to just verify that that's the date and time that it is correct. Wonderful. So that is the new changes to the ThedaCare. So I'm going to go back to my PowerPoint.
Can I give you some feedback on that quick?
Sure.
If you're ever setting it up for your child, after you've gone through the steps to get the appointment, it doesn't give you any confirmation that the appointment has taken. And I've been explaining it has to do with child protection rules.
It depends on the age of the child.
Right. But not knowing that, I've went through it a couple times, thinking it didn't take. Next thing you know, I got 3 appointments scheduled for him. So I guess, is there any way you can at least have something pop up that says successful, appointment successful, or something to that extent? Because it's left vague.
Yes, and I think that that could be an option. We are experiencing another upgrade coming up. The issue sometimes with the ThedaCare is because it's an Epic system. So this isn't a ThedaCare system, it's actually an Epic system. So the changes that we make to that has to be more of all of the Epic system.
So it's like iSeries.
Yeah. That was terrible.
Okay.
More progressive than that.
Well, there's a lot of hoops to go through, but yes.
Better than the iSeries.
If you're ever wondering, you can certainly call the clinic too, and we can let you know, so you don't have to.
Well, they ended up calling me and telling me I scheduled 3 appointments. So I said, well, pick one.
Okay. Well, and we do look at that on our end too, just to
No,
make
you guys
sure.
caught it, so that's all good.
Yes, so, and that's what we try to do on our end, is to catch those things. So, again, this is our address, our phone number, and our fax number here. I wanted to start off with the negatives, so I wanted to talk about what we don't do and then go to what we do. So the first thing is we still want you to have your general practitioner, so your primary care physician. We want you to keep them, so we're not taking the place of them. So if you get medications renewed, please have them renewed by that physician. We don't remove anything from the eye. We don't have the type of equipment that will do that, so we don't take anything out of the eye. Routine childhood vaccinations, again, we would want your child to be seen by their either pediatrician or primary care physician. We don't see urinary symptoms for children under 12. X-rays and diagnostic tests, we do have the ability to order them, but because if we send you to the hospital, it's actually double the amount because they look at it as a hospital X-ray. So we would send you off to maybe another clinic to get it done, just to save on cost. So you're aware of that. Chest pain, we do not have EKG machines, so we do recommend that you go for any chest pain. Of course, you would like an EKG to be seen either in the emergency department. I know ThedaCare has a urgent center now in Circle, and they have EKGs if you're interested in going to someplace other than the emergency department. Mental health, we can be that first step. We can help you to navigate the system because sometimes it's very confusing, so we can be that first step, but we do not have mental health providers. And then ADHD medications, either for the adult or child, needs to be done by the person who actually prescribed it, so we don't do the checkups for that. So then, what do we do? Well, vaccines. So we have tetanus, pneumonia, flu, hepatitis A and B. We do TB testing. We do free lab work, so if your physician is looking for you to get labs done for any reason, we can do that there. If it's a ThedaCare physician, we can just pull those labs over because they use our Epic system. If it is a physician that does not use our system, we just ask that you call ahead and have them fax us the orders so we know what we're drawing. I don't know if anyone has heard over the radio or TV, they have hepatitis C screening now, which is really important. If you were born between the ages of 1945 and 1965, they would like everyone to have a screening. What that involves is just a blood test, and it's a one-time blood test, so we check to see if you have hepatitis C. The reason why they're pushing it right now is because they have medications for it now that can get rid of it, where they didn't in the past. So it's another type of thing where it's a screening tool that we ask you when you come in. Allergy shots, we do not have an allergist on site necessarily. You need to go to see an allergist, but for those poor people that have issues with the pollen that's out there or maybe bee stings, and they can get a serum made, but that serum is injected once a week to build up their immunities. So we don't necessarily make the serum, but once you have that serum, we can actually do those injections weekly.
Can you do the shingles vaccine too?
The shingles vaccine is one of the ones that we're looking at getting. We do not have it as of yet. Actually, there's a nationwide shortage right now of it. Shingrix is the name of it. The previous shingles vaccine that they had was only 40% effective, where Shingrix is 90% effective. They had to give it 60 and above because its life expectancy of the vaccine wasn't very good. This one we can start giving at 50. So you might see that on your ThedaCare chart where they're recommending it. This one is a 2 vaccine system, so you get it once and then in 2 months you can get it again. It's 90% effective. I do recommend it, although again, there's a nationwide shortage. The one thing that I do mention with it, and I would before I give the vaccine if we end up getting it for the clinic, is the fact that it's a little bit, it makes your arm hurt a little bit worse than tetanus. So I just recommend that because a lot of people think, oh, I can't get it again because it made my arm hurt. Well, that's kind of the part of building up the immunity, unfortunately, is that it's got to hurt a little bit more. But we are looking at getting it in there. I would suggest if you're interested to go to Walgreens right now because I know that they have it.
I know Shopko has it too, but if this is cheaper, I would wait a couple months.
It would be cheaper. I had no expectancy, like a date of when we're going to get it, though, at this time. Dermatologic issues, so rash, cysts, boils, this time of year with going out into the woods and ticks. If you feel that you have a tick and it has caused some issues, you can certainly come in and get tested for Lyme's disease. Referrals for colonoscopies, mammograms, DEXA scans, sleep apnea. We can't do anything with the sleep apnea machines. That's usually done by a pulmonologist, but we can help you again with that first step in getting seen and figuring out if you need to get tested for sleep apnea. Also, we do children's camp and sports physicals. If you have a child that's in sports, those are good for 2 years, so we can do that at our clinic. Kinesiotape, which is more of an orthopedic conservative treatment, we can do that at our clinic also, and that's usually done by me. Stress management, we are again that first step, so we don't have a mental health provider, but we can help you to navigate which would be easier for you. Non-pharmacologic sleep issues, and I say non-pharmacologic because a lot of our providers, the sleep medication out there isn't bad, it just has some pretty bad side effects, so we try not to ever go with those medications. I know I have a friend personally who got up in the middle of the night and got tickets to a Broadway play in Chicago, didn't know she did it at all. So, people have woken up in the highway driving with some of these medications, so we're gonna, and I have a slide later on that goes through what we would recommend, so I would probably stay away from the medications if possible. Lifestyle, so healthy eating, medication reduction, and smoking cessation, monitoring blood pressures, and then everyone's favorite, why they're here, is learn about ear flushing. So I talk about that because some people, specifically people who have to wear hearing protection on their work, their earwax tends to build up because they always have it blocked. So what this does, the symptoms of having too much earwax or blockage is decreased hearing, ear pain, plugged feeling in the ears, ringing in the ears, dizziness, itching or drainage from the ear canal. One of the things that we can do also is I tend to mention the plugged feeling because that can be an obstruction in the ear canal, but it also can be because of our seasonal allergies right now. What happens when you have seasonal allergies is your sinuses, of course, get inflamed. When it gets inflamed, this eustachian tube, so the fluid that drains behind the eardrum, gets blocked. And if it is blocked, then you get that plugged feeling in there. So sometimes when you come in and say, you know, I can't hear very well, or I have a plugged feeling, we would look in the ear, say, no, actually it's pretty clean, and have you see one of our providers to go through and discuss what would work the best for you as far as, you know, with seasonal allergies and sinus issues. So that's one of the things that we can do there too. Sometimes people just want to know what to do on their own at home, and these are some home remedies as far as what you can do to soften your earwax on your own. My personal favorite is the hydrogen peroxide. What I like to do is put about 2 to 3 drops in the ear about 5 minutes before you go into the shower, and then when you take a nice warm shower, you'll actually feel that you can even, it sounds like bubbling in there, and then the shower will help to rinse some of that earwax out. We, of course, do not tell anyone to use Q-tips. You shouldn't put anything smaller than your elbow in your ear, which of course is nothing. So, and then swimmer's ear. So people who have issues with swimmer's ear, we usually tend a mixture of water and vinegar, a couple drops in there after you're done swimming, and it will prevent some of the issues with swimmer's ear. So what if you have a ear infection? Can you get an antibiotic? Well, yes, that's what we do at the Connecting Care Clinic. The one thing that we're trying to tell people, though, is, and I like to use the antibiotics as our new narcotics. I remember it wasn't even that long ago, 10 years ago maybe, you would go in with knee pain or back pain, and the doctor would give you a prescription for narcotics. Well, what happens is we're having an issue now with an opioid crisis. And what we found, too, is it wasn't necessarily needed. So back pain specifically, the reason why we tend to stay away from that is we don't want to give a narcotic that just masks the pain. We want to give an anti-inflammatory that will help the inflammation go away in the back. So we're learning new things, specifically migraine. People who suffer from migraines, if we give them a narcotic, they get a rebound migraine as soon as that narcotic wears off. So we're finding that the treatments now are better without narcotics, which is a good thing too, because again, the opioid crisis that's going on. But one of the things that we're finding out with the antibiotics is there's superbugs now. We have gotten to the point where pharmacies are not making any new antibiotics, and we've gotten to like superbugs that are resistant to a lot of our antibiotics. Reasons why, a couple reasons. We tell people if you have a prescription for antibiotic that runs for the full 10 days, well, don't stop after 5 days. I know some people are like, well, I'm feeling better, or they forget to take it, but what happens is that bacteria now builds a resistance to that antibiotic. Or I've often heard, well, my wife didn't use her antibiotics, so I wasn't feeling really good, so I took a couple of them. Well, actually, if you're not taking the right antibiotic for the right bacteria, it also causes the superbugs. So we generally tell people, yes, we will certainly give you an antibiotic for bacteria, but we are very careful of our antibiotic use because, again, they're not making any new antibiotics. We're running out of them. So how do you know if it's going to be helped with antibiotics? Well, antibiotics are great for bacteria. Viruses, they don't do any good for. So Actually, 98% of cases are usually viral, so they're viruses. Anywhere from 2% of our bacteria. There's over 200 different viruses that cause cold and sinus symptoms. And then sore throats. Generally, the first sign of illness is a sore throat. Well, how do you know if it's strep throat? Well, we can do that testing at our clinic. We do a rapid strep test. The rapid strep tests are best if you have a sore throat for 3 to 5 days. They're about 95% accurate. If you come in after 2 days, what we would normally do is still do a rapid strep test, but we would send it on maybe for a culture. And what they do is in our lab that they would grow it just to make sure that it is not strep throat if you're coming back with a negative. So you can get that done at our clinic. Viral symptoms usually resolve anywhere from 7 to 10 days. So that might be a good indication, like, you know, I've had this cold for more than 7 days. Come in and see us, because that's a good indication that it may be more bacterial than viral. If by chance you have any underlying conditions, asthma, diabetes, we would want you to be seen a little bit earlier, because those can become a little bit nastier, a little bit faster. So come into the clinic and see us sooner. Most upper respiratory symptoms, though, take anywhere from 7 to 21 days to resolve. And I know they've been doing a really good job right now of increasing our tetanus with the pertussis. We are trying to get everyone vaccinated with that. The pertussis, of course, is whooping cough. Whooping cough also has another name. It's called the 100-day cough, and it's literally can go on for that long. So, but we're doing a really good job with making sure everyone has their pertussis up to date. So what can you do at home? Let's say you want to make sure that it is more, if it's a virus, what can you do to help your symptoms? Well, over-the-counter decongestions. Afrin is good for decreasing the inflammation in the sinus passages, but we do not recommend any more than 3 days. If you use it for longer than 3 days, what it does is has a rebound effect and actually makes your sinuses worse. So it's good, but no more than 3 days. Sudafed would be the stuff behind the counter, and that is good for anywhere from 12 to 24 hours, and that'll decrease congestion. Your Mucinex will help to thin the secretion, so if you have a cough, you can cough some of that stuff up and get it out. The problem with Mucinex is a lot of people don't realize that they need to increase their water consumption. If you don't actually take on more water, it actually doesn't help to decrease the secretions or thin them. There's nasal saline irrigations. People use neti pots, and that tends to help. I love that they're going back to some of the remedies that I know my mom used. The Vicks at night to open up sinus passages also. Your Tylenol or your ibuprofen is great, but we do recommend more so the ibuprofen because your sinusitis, your sore throats, they're all caused by inflammation. So if you can get an anti-inflammatory on board, you're going to feel better with that. Some people ask me for a home remedy. Do you have any type of home remedies? Dr. Farrell is our head of our lifestyle medicine. She recommends this medication that you can find at some of the home remedy stores that are out there. Vaporizers are great. There's actual tea to help with sore throats, chloroseptic spray. Ear pain, sometimes warm compress can help, but we want the bad ear to be up. Again, it is just the way that the eustachian tube will drain into the sinuses. If you have it down, it doesn't drain. So your bad ear should be up if you're using a warm compress. Get plenty of rest and fluids, and of course you can always see us at the clinic too to make sure that it is viral or bacterial. Wanted to go on now to talk about stress. This is an interesting fact. A lot of people don't realize, you know, everyone has stress in their lives. But one of the things that it does is exposes, especially chronic stress, exposes your body to stress hormones and adrenaline and cortisol. And then the studies show that that can actually help you to actually prevent, prevent the blood clots, which can give you the risk of heart attack. So stress, more of an emotional thing, can actually cause physical problems. And how else is that? Look at all the different physical signs of stress. Dizziness, general aches and pains, sweaty palms, stoop posture, weight gain or weight loss, and that's just physical signs. Mental signs, worrying, forgetfulness. I like this. If you have a coworker that doesn't have a sense of humor, it might be under stress. Emotional signs. So you have anger, anxiety, nervousness,